next, I want to, Carrie, I want to pose you a question. Caring for our well-being on an ongoing basis is a really important part of preventing burnout, but sometimes it's the last thing that's on our list. I know I am guilty of that. It's easier to focus on all of the external things that I need to do and not be as focused on my own self-care. It just feels easier to do that for some of us. So, what are the most important things that we can do to care for our body to really support our mental resilience in today's environment?
Yeah, thank you for that, Michelle. The most important things that you can do, that I can do, that everyone can do are the things that help each of us the most, right? So it's individual. What might work for you to refill your cup, to help boost your resiliency, keep your immune system high. It's going to be very personal. There are, however, with that being said, some fundamental elements that across the board, all of us share that can help to support our mental resilience. These things include things like getting quality sleep, which for many is a challenge right now for multiple different reasons, right? Some that we just alluded to. Getting things like proper nutrition, variety of fruits and vegetables, super important right now. Just healthy general eating and moving our bodies. So being physically active in ways that work for ourselves. Each of us is different. Each of us likes different things for ways of movement, and each of our bodies are different. And so those, I would say, are some fundamental shared aspects that can help us to care for ourselves and build our mental resilience. Jeremy, I'm going to ask you to expand a little bit too, more about the nutrition element, because that really falls under your wheelhouse. And you talk a lot about that. Are there ways that you can see nutrition, healthy eating, more specifically connecting with preventing burnout?
Yes, that's a great question, Carrie. And what I would say is more research is there's a bunch of research coming out right now that supports that, our diet has such a significant role in our mental well-being. Like if we think about this in like the most simplest terms, right? We are what we eat. And again, our brain needs fuel to function properly. So if we start to think of our brain as like a well-oiled machine, we have to start eating food that supply that good energy. Like one analogy that I really enjoy using. So my wife's uncle is a farmer, and he has this huge diesel truck that he needs to do work around his farm. So, and it, like I said, it's a diesel truck. It's a diesel fuel truck. So if my wife's uncle goes to fuel this truck with a regular 87 unleaded gas, it's not going to work, right? It's not going to work properly. So we have to start thinking about what we put in our body as in this way. So, and like thinking about it in terms of science, right? There's a lot of neurotransmitters that are produced, and neurotransmitters and hormones that are produced within our gut, and these things are what kind of give us that happy feeling, like serotonin, right? So we need to eat foods that promote that. And some of these foods are prebiotic and probiotics. And these are things like beverages such as kombucha, kefir, fermented foods and beverages. And then also some prebiotic foods, right? So things like fruits, vegetables, things that feed that healthy gut. Sometimes we can do everything we can internally to take care of ourselves, and we can still not be where we want to be. So what are some external resources that we can start to tap into when we start to feel like that? I know a couple that I have done is reach out to some facilities, or resources that we have on campus, such as FSAP and the colleague network groups. Currently, I'm part of the Men of Color colleague network groups, and also tapping into some of the mindfulness and meditation apps can be important too. Some free ones out there are Insight Timer and Headspace. Another couple that I really enjoy that are supported by the BIPOC community are Elevate and Liberate. So I would definitely suggest those to any people within those communities that are looking for those type of resources. I'm going to kind of pose this question to everybody right now. What are some other resources that we can start to tap into as well that are external?
Jeremy, I'm going to piggyback on that a little bit and expand on those resources as well. And thank you for sharing those too. Those are excellent resources. Cornell Wellness and Cornell Health offer a lot of free mindfulness services and programs, and they include things like Let's Meditate. Lots of other guided meditations are out there and being offered on a daily basis. Guided relaxations, journaling opportunities, things like relaxing breathing exercises. A lot of these are delivered live through Zoom on a weekly, if not daily basis. Many of them are also recorded, so it can be tapped into 24/7 for people. Personally, I just started meditating about 6 months ago, and it's been a game changer for me. I wasn't sure. I tend to get my relaxation and my mental boost from doing highly active movement type things like running. And so being still for a while was challenging for me at first, but has been life-changing. So whether you are a complete beginner or a person who's advanced with mindfulness techniques, I would strongly encourage them. They can be a game changer for, I think, everyone. And again, also personally, I'll share that at times in my life, though, even doing a lot of these things has not been quite enough. And so I've reached out to a counselor through FSAP, and that has been extremely helpful as well for me, just to level up in my mental wellness. And so, Michelle, I'm wondering if you can help others like me as well understand a little bit more about the counseling services that are available to employees at Cornell.
Sure. Thanks, Carrie. So you've heard the term FSAP, that stands for the Faculty and Staff Assistance Program. It's also known as an EAP in many circles. The Faculty and Staff Assistance Program provides free counseling services to benefits eligible employees and their spouses, partners, as well as retirees. You can reach out by calling 255-2673 or going to fsap.cornell.edu. This is a great program that's available to you Monday through Friday during business hours. If you need support outside of those hours, evenings, weekends, or you just want an alternative, E&I Confidential Counseling Services is a program that Cornell contracts with to provide mental health care 24/7. Their telephone number is 1-800-327-2255. Cornell employees, spouses, and partners and retirees all qualify for 3 free visits. What I love about this particular service is that you're eligible to use it regardless of where in the United States you live. So that's a great benefit that's available. And of course, you may have personal counseling needs outside of these 2 services that are appropriate for using your health insurance plans. To learn more about your coverage options with both Cornell Health Plans and the Empire Health Plans, visit hr.cornell.edu. I think one of the things that we've been able to benefit from throughout this pandemic is just the accessibility of information and healthcare, because so many things are virtual now that weren't previously. So we have seen an increase in the number of individuals providing virtual counseling services, and many of the free resources or small cost apps and platforms that Jeremy and Carrie mentioned, I know I've personally benefited from as well, just for my ongoing wellness.
I'm really happy to see that, we've been discussing the resources. A lot of times it's underutilized, and Jeremy touched on men of color, Black men. Sometimes there's stigmas in certain communities where there's a belief that seeking mental health treatment or counseling or anything of that nature is a sign of weakness. Like there's a negative stigma attached to it. But it's quite the opposite. When we look at it as, your mental condition is equally as important as your physical condition. In fact, sometimes your mental condition can trigger physical symptoms. For me, when I get stressed, I get neck pain, back pain, abdominal pain sometimes. So sometimes folks may come in for a medical exam and say, hey, doc, I'm having pain in my neck, back. But what's at the root of it is actually anxiety and stress. So there's really no negative stigma. And you can look at it like a fitness trainer where, we need a coach. We need a fitness trainer when we're trying to get into great physical condition and health. So it's similar for mental health, where talking to someone sometimes will allow you to now understand and recognize how you can have a peaceful state of mind, how you can cope with anxiety, cope with stress and depression. Um, and those are some of the things that manifest out of, isolation, burnout in this world now where, we're limited. And I'm thinking about even the holidays. Earlier I saw in the news, the mayor of Chicago just suggested people don't even go and have Thanksgiving this year because of the, risks associated with that. So I know that, even in my household, we're deciding, should we just stay here in Ithaca and just call folks, So it is a challenge. And it's also, again, we've been under a lot of stress with the isolation in the workplace. And then now the holidays are coming. It's apparent that, we may not even have that as an opportunity to socialize again how we normally do. So I definitely recommend folks take advantage of the resources, even if it's not something mental health related. For example, FSAP can also address social support. For example, if you have an elderly parent or if you have a child with special needs, they often can help guide you to the right resources. So it goes beyond just helping your immediate mental health needs. It also can help you with your social needs.
Hi, John. Thank you for addressing those issues, especially when we talk in terms of stigmas. I am a Black man, and I feel that in our community, and again, John kind of touched on this a little bit, is that it is a very much a stigma to admit that you need help in the mental wellness department, being a Black male. And I think that the more that we start to have this conversation and we start to realize that there are more people that are like us that we need to address this issue. And so talking about it in these forums is super important. And I would also suggest that if you are this person and you are feeling this stigma behind you, and it is hard for you to reach out, start talking to your friends, talk to your family. Um, and I guarantee that you will find somebody within your friend group or within your family group that is going through the same thing. I know for myself, I've been really very much so into reading lately, especially literature from other Black males that have experienced mental health issues. I just got done reading this great book by Charlemagne the God called Shook Ones, and he really addresses the mental health issues behind specifically Black men and anxiety. Some very colorful language in that book, but I would, if you can, I definitely suggest reading that. Also, another thing that I really like to do that's really helped me is positive affirmations in the morning. As soon as you wake up, really just, when you start to express gratitude, it starts to make you feel a lot better about your day. So the first thing I do when I wake up, I wipe the eye boogers out of my out of my eyes, and I thank whoever it is you worship, and thank God for waking me up in the morning, and ask for divine protection over me and my family, and give me the strength that I need to spread love and compassion throughout the day. And I think that when we start to do that, it starts to really kind of address where we're at. So having a positive mindset has really helped me. And I'm wondering, John, is there any medical benefits to having that positive mind frame as well?
Yeah, great question. Great observation, because it does. So it is shown that if you have a positive outlook and you are optimistic, where you view the good, look for the good things and all, you actually do have better health outcomes. So I definitely urge everyone, even, in these times, I know some of the things that I shared and in this group can bring you down, and that can actually steer you towards depression, towards anxiety. But if you have a positive outlook, I often do this. And part of it, I guess, is being a doctor where, you do have to often give folks news that might be bad. I always try to find a good side in everything, and try to point out light at the end of the tunnel, even with the pandemic. As bad as it is, it's happened before. In 1918, you had the Spanish flu, and we overcame that. And for 100 years, we weren't faced with anything like that. So based on our past, we know that moving forward, there is light at the end of the tunnel, and we'll get over the pandemic. We've learned a lot from it. I think now in this country moving forward, people recognize the value of wearing masks when you have an infection. I know in other cultures, other countries, in Asian countries, they've been doing it for years. And, sometimes people viewed that as something strange, but now we have a greater appreciation for that. So yeah, even though this might be a time where folks are really down, try to remain optimistic, in whatever situation you're dealing with. Always try to identify, what is the good in it, because sometimes be just something you learn from it, so that you kind of, as you move forward in life, you don't repeat the same thing. But yes, optimism is definitely key. And part of that, again, is taking advantage of the mental health resources, where you can get a sense of hope. So if, substance abuse and alcohol use and drug use sometimes is a form of self-medication. So folks are actually trying to escape their circumstances, right, where they're in a place of optimism because they're not thinking about the negative. So they'll use drugs or alcohol to do that. So it's a healthy approach to always try to find that positive place where you can kind of get your mind focusing on good things and positive things, as a way to avoid going down a path of certain illnesses, and stay positive and focused to the future.
I do want to mention, though, too, in case people are thinking, well, is burnout really serious? Does it actually have medical consequences, and what can happen if I don't try to either reach out for help if I'm in kind of this negative spiral, or do these things for taking care of myself and spending time on that. I know personally, I get kind of warning signs, and I can tell when burnout for myself is encroaching, because I wake up and the first thing that kind of pops into my mind is, how many hours left do I have to get through before the end of this day? And then I start going to, okay, and how many days are left till I get to the end of this week? And that's my sign to say, all right, I need to do something else, have different strategies to help kind of get me on a more positive track. So, to reinforce how important it is to take those steps and to acknowledge, burnout, and when we're getting close to that place. Can you tell us from that medical standpoint, what are some kind of long-term consequences if we don't take these steps?
Yes, thank you for asking that, because there are several. So, burnout, if it's not addressed, can lead to chronic fatigue, insomnia, sadness, anger, irritability, alcohol and substance abuse and misuse, as I touched on before, heart disease, high blood pressure, type 2 diabetes, and a weakened immune system, which during, this pandemic, you want your immune system to be strong. So yes, burnout can cause you to now be more susceptible to getting an infection. And then what I would say is, it was touched on earlier about the elements of good health. So sleep is very important. So the keys to a healthy immune system, and I'm highlighting this because even once the vaccine is available, if your immune system isn't working properly, the vaccine may not work effectively with you. So you have to understand that your immune system is key to the vaccine actually working. So the elements of a healthy immune system are sleep, drinking plenty of water, eating fruits and vegetables, and actually getting exercise. Like those four are the key components. And I've been urging folks that, focus on that, right? Like, it's important, wear the mask, do social distancing. But if you encounter the virus, right, if your body comes in contact with it, or it comes in contact with your body, you really want your body to be equipped to fight it. And so that's important to recognize, that the impact of burnout can actually cause you to be more at risk to get corona if you get exposed to the virus.